It is Medical Monday, and we're starting with how to enhance or even make some changes to how you look. When I dropped my son off at elementary school years ago, a kid asked if I was his grandma. Really, kid? To be fair, I had my son later in life, so I am old enough, but I didn't need to look like it. I got like a little wrinkle reducer between the eyes, and that kid never saw me frown at him again. With today's advancements in aesthetic medicine, there are several options, from temporary fixes to surgery, to correct what bugs you when you look in the mirror. Joining us with various ways to get what you want is plastic surgeon Dr. Monica Wentworth with ACPS and aesthetic nurse Summer Bora. Good morning.
Good morning.
All right, I want to start with kind of your background, because it's always interesting to me how we always go into the field that we go into, and oftentimes that impact started at an early age. You were around the medical field at an early age.
Yes, ma'am. I spent every summer at LBJ Hospital with my mother, waiting for her to take us to Astroworld at lunchtime so we can go and enjoy the park until 5. But I was able to be exposed to lots of different types of doctors, but importantly female doctors, and that really helped push me to pursue a career in medicine.
Yeah, why plastic surgery?
It's creative. No body is exactly the same as another, and so we get to use our creative juices in talking to patients and planning customized treatment protocols for them. So I love that. And we also help improve people's confidence and make them feel good about looking in the mirror. So all of that feels so good, and I love my job.
Yeah, it's more than a procedure to you.
Yes, yes. It's a calling, and I definitely take it very seriously. And I love, again, taking care of women and men who just want to feel better about how they are aging.
If we're living longer, we don't have to look like we're living longer.
That's right.
All right. Summer, you're a registered nurse, practicing aesthetic nurse as well. Explain what that difference is.
So a registered nurse, we take care of patients, and we're able to make plans of cares underneath a doctor. And then an aesthetic nurse, we do Botox fillers, and we do non-surgical treatments to kind of help improve the look of whether it's aging or if someone's wanting to tweak something a little bit, so we're able to do that.
Yeah, yeah. And the nice thing about that is that obviously nursing is a calling as well. You're a caretaker, right? But this is kind of, I would call, the happy side of nursing.
Yes, absolutely.
Yeah, because you're dealing with the aesthetics and things like that. All right, let's start with neck or a facelift. Sometimes those are done in conjunction with each other, but it's one of the things that can make you look older than you are. It's just, gravity and time.
Yes, absolutely. So, everyone is different as far as their anatomy and what they need. So it's always important to consult with a board-certified plastic surgeon to discuss the goals and what you don't like to see in the mirror. Oftentimes it starts, you start noticing a little bit of jowling here, and then as we look down, we'll notice our neck just having excess skin. So all those things can be, you can help kind of ameliorate them with fillers, but over time, most of us are going to need to consider some sort of procedure to correct them. So the lower face or the face and neck together.
Yeah, you say lower face because sometimes there's the whole full meal deal, right?
Yep, exactly.
But then sometimes it's just picking up this part here or the neck part. So in that process, about what's the downtime?
Well, it depends on...
Before you're out at a party saying, no, I didn't do anything.
Yes, exactly. It depends on what your goals are. So you look great to go just to lunch or to the grocery store, at about a week. At 2 weeks is safe to say you can be seen at a party or presentable.
Yeah,
exactly.
All right, and healing time?
Healing time is around that time as well. You heal remarkably fast, but we take sutures out at 5 days. We have you kind of wearing a cooling device as well as some compression for about a week to 2 weeks, depending on the extent of your procedure. And then honestly, 6 weeks for all the swelling to go down, but the majority is gone by 1 to 2 weeks.
Yeah, and then you have that discussion. Let's not continue to do the things that aged you, right?
Right,
if you're smoking, understand what smoking can do. Heavy drinking, understand what, being out in the sun, understand what those things can do.
Correct.
So it gives you kind of a little chance to push the restart button, if you will.
Exactly, that's so true.
All right, some of the non-surgical solutions are the thing called PDO threads. I'm really amazed by that's almost like a new a part of medicine where it's when you're not ready for the full meal deal yet, but things you can do to give you more time or just change those looks.
Yes, so the PDO threads, they're dissolvable sutures, and it's not for everyone, so it's very important for people to come in and make sure that they're actually a candidate, because sometimes people need combination treatments like filler and PDO threads. But what that can do is just very temporarily lift up the area of the face that needs to be lifted. And then I always tell people, you're gonna need a facelift in the future, but this is just gonna help you know, maybe turn
Bridge
back
the
the
gap.
clock a little bit.
Yeah,
So.
yeah. All right, and then of course we know fillers can do a lot.
Yes, and we at ACPS, we love to just really like enhance and maybe replace lost volume and not really change the look of someone's face. I know everyone's very scared of the pillowy look, the filler face, but
Some
it
people
doesn't
want
have
that
to,
pillowy look. Yeah, if you want it, you can get it.
Yes,
But, yeah.
exactly. Some people like it, but we like to, you know, either just turn back the clock a little bit and replace lost volume, but not really change the whole face.
Yeah, when we talk about fillers and even like a facelift, we know a lot of people are losing weight rapidly with
Right.
the 𝙬𝙤𝙚𝙗𝙠 and things like that. So that wasting in the face makes you look even older.
Absolutely. If you look at children or babies or yourself as a younger person, one of the major differences is skin quality, of course, from UV exposure and damage, but a lot of it's volume. We lose volume in our bone, our soft tissue, and so yes, exactly with the semaglutide and the weight loss injections, people are essentially looking great and feeling great, and overall going to help reduce their morbidity and mortality, but they also lose a lot of volume in their face. So that is something that we see very commonly, and oftentimes it's leading people to facelifts a little bit earlier.
Yeah,
because
yeah.
there's really not enough volume to kind of replace what you've lost.
A young lady the other day was horrified when she was complaining about the wrinkles that she has. Or not, it wasn't really wrinkles, it was the expression she made, the wrinkles that you saw when she made an expression. I said, well, you should probably get like a wrinkle relaxer. And she goes, I'm too young for that. That doesn't really have anything to do with age. It has to do with preventing those wrinkles from becoming permanent and setting in, right? So
Exactly.
yeah,
Yep,
so you
got
could
it.
deal with that, stop that action to begin with, like that little kid in elementary school. See, those 11s are no longer here, and he didn't know how I really felt about him. Okay, forehead lines, crow's feet, all that stuff. Daxify is a wrinkle relaxer that y'all use. I know there's lots of brand names out there, but this one
Yes,
is the one that you
we
use?
carry all of them because we like to have options for patients, but we've been loving Daxify. It's a little bit newer, but it's made with a peptide instead of an accessory protein. So it also makes the skin look very glowy, and so the appearance of the skin looks really pretty.
Oh, okay, we like that. Okay, some other services, eyelid surgery again. So for some
Yes.
people, the lid starts to droop and you almost can't even see. I think insurance even pays for something like that. But
Yes.
otherwise, just when you have sagging eyes.
Exactly. Well,
you know?
women, we like to, look great when we go out and have dinner and put on our eyeshadow, but sometimes you start to notice, okay, I don't have as much surface area to apply my eyeshadow, and then that kind of starts the, kind of the recognition of there is a little bit of laxity. So removing that skin, also doing what we need to do to really assess your brow position, all of the, again, coming to a plastic surgeon is really important to assess really where you're at. But something as simple as removing skin from the upper lid is so instrumental in making you feel just a little bit, again, it opens up the eyes, makes you feel younger, and again, kind of lessens the burden of the aging process.
Yeah, now we've got the neck and the face taken care of. Let's go a little bit further south. We know, again, gravity, breast, especially after having children. So
Yes.
you can augment that. With some people want the reduction. Some people,
Right.
Want them to be fuller. And then there's the mommy makeover.
Yes, just one of my favorite procedures, because honestly, we give so much to become mothers, and and we love our job. We also want to continue to love our bodies, and so the things that change with your breast after breastfeeding, they lose volume, they deflate, lose position. The nipple areola complex will be a little bit lower than we want it to be. So often it's again an assessment of how much volume you want to replace, and again, a lot of times you need a lift to get that complex and the position of the nipple right where it's supposed to be.
Yeah, and then tummy tucks, yeah.
yes, and that is such a huge improvement in the quality of life for mothers or women in general, especially for people who've lost weight. But essentially, that's removing the lower abdominal skin and tightening the muscles so you can get that nice waistline back.
Yeah, because no matter how many crunches you'll do, sometimes that's just not going to go away.
No, unfortunately, the muscles will separate to a point that you won't be able to get them back together without a surgical procedure to tighten them up.
Yeah, so again, come in. You may have something in mind. It may not have to be as far as you were thinking, or there may be something you weren't thinking of. Look through you have lookbooks,
Right,
you have
exactly.
videos for people to look at,
Right.
and then you can sit down and discuss with them what they might want to do. Ladies, thank you very much.
Yes, thank you.
you.
All right. In fact, all three of us here were 150 years old, but you would never know this, would you? Okay. If you want to feel comfortable in your skin again, again or want to tweak some things, contact Dr. Monica Wentworth or Summer Bora at the Aesthetic Center for Plastic Surgery. Right now, ACPS is offering several special promotions. Receive $2,000 off a facelift or $2,500 off a facelift with a neck lift until the end of September. So just get your appointment in. If you're not quite ready for surgery, receive $100 off each syringe of filler until the end of August, or 15% off PDO threads until September 9th. To book a consultation, here's the number, 346-258-7776. Again, it's 346-258-7776, or visit acps.com.